So what I want to talk about is to some of the research studies that we have done, which informed some of the materials presented in the book. And one of those studies had two phases, and it was focusing on the relationship between tinnitus and sleep. So in phase one, we had data for 417 patients. We analyzed them. We conducted a statistical analysis called mediation analysis to explore the mechanism in which tinnitus loudness can create sleep difficulties. And the second phase of the study, we looked into whether cognitive behavioral therapy can actually help people to improve their sleep difficulty, to reduce the sleep difficulties that they are experiencing. So this was the model that we created based on the data that we analyzed. At the top bit, the first part shows that the tinnitus loudness has a direct and significant relationship with the sleep difficulties. When we had a model which had only tinnitus and sleep difficulties included in that model. So that top part basically means the louder the tinnitus, the more sleep disturbances we have. But there are hardly ever only two factors in our experiences. There are lots of other different factors that needs to be taken into consideration. So we tried the second model, which is the mediation model, in order to understand if we include other related factors that people who have tinnitus also experience into this model, will the relationship between tinnitus loudness and sleep difficulties remain significant? So the model showed that the impact, the relationship between tinnitus loudness and sleep difficulties was fully mediated by factors like if tinnitus makes you feel depressed, if you're annoyed by your tinnitus, and if tinnitus impacts on your life. So the direct relationship between tinnitus loudness and sleep difficulties became insignificant when we added these factors into the model. So what does that mean? I'm going to explain that a little bit more. First with an example which is not tinnitus related. And imagine a woman, before she mixes an ingredient for a cake before leaving the house to work. And then she put the ingredients in the oven. When she go to work at 4 o'clock, she calls her husband and asks him to make sure, turn on the oven. She wants the cake being baked when she's back from work. But the husband is forgetful. He only remembers to turn on the oven 50% of the time. So, therefore, every time that the wife calls, the cake does not necessarily being baked. So it is the actions of the husband is essential there. If he doesn't turn on the oven, the cake will not be baked. So now we take that to the context of tinnitus. Tinnitus is the telephone call, and cake is the sleep difficulties. So between the telephone call and the sleep difficulties, there are other things that need to happen for tinnitus to lead to sleep difficulties. And so before I explain that a bit further, so what is it? So obviously we want not to have the sleep difficulties. And so in other words, we want to avoid the cake from being baked. What to do? One option is to try to distract the wife, not to call. It's a hard thing because she likes the cake. So the second option is to work on the forgetful husband. And that, I think, is your best bet. Now, going back to this model that we created, so the model shows that if tinnitus makes you feel depressed, this one, or if you're getting annoyed by tinnitus, or it is impacting on your life, then you will have sleep difficulties. But these are the mediating factors, these are the actions of the husband there. Now, and cognitive behavior therapy can help you with this. Because in cognitive behavior therapy, you learn that there are cognitive behavioral processes between the loudness of the tinnitus, and creation of the emotional disturbances that we experience. So in CBT, or cognitive behavior therapy, you learn to recognize those cognitive and behavioral, those thought process and actions that you are taking, and modify them. So you are not feeling depressed, although you're hearing tinnitus. You're not getting annoyed, although you're hearing tinnitus. So therefore, what will happen, so you are working on the mediation factors. So in other words, if you are hearing tinnitus, but you are not depressed about it, and you're not getting annoyed by it, then it will not impact on your sleep, or your sleep difficulties will reduce. So the second part of the study was to basically test that. So we had a group of people who enrolled in cognitive behavioral therapy focused on management of the tinnitus, and before and after treatment, we asked them, we used a standardized measure of insomnia to see if there is any change in their sleep difficulties that they are experiencing following CBT. And there was. Their score significantly reduced after the CBT. This study was not a controlled study, but there are lots of other randomized controlled trials on this topic, which having the same sort of result consistent with this. Well, thank you very much for listening.